What is a bunion?
A bunion is a bony deformity on the feet. They can be either on the inside of the foot that we call the first metatarsal head. They could be on the fifth metatarsal head. And what happens over a period of time is that the bone starts to protrude. The bone develops what we call some arthritis or some changes in the bone. And the bigger it gets, the harder it gets to fit into a shoe. And it becomes uncomfortable, sometimes even without a shoe, as the irritation and the arthritis develops and progresses.
What's the most common reason a person would get a bunion?
Most of the time it comes from what we call genetic factors in combination with the way they're walking, such as what we call pronation of the foot. Shoes obviously aggravate it, but most of it really comes from the way we're walking, which is what we call biomechanical.
Okay, if someone has a bunion and it came to you, how would you approach the problem?
Well, what we basically do is we evaluate them, we see how they're walking, we see how they're standing, we see how much the bone sticks out, we make sure there are no infections or signs of some other injury in that area. We then have them walk for us, as I said, in our gait analysis. And then what we do is we take an X-ray to evaluate the situation with the bone, making sure that there's nothing else there besides the typical bunion. We rule out any gout or arthritis, any bone spurs. Sometimes we see a cyst or a tumor in that area. We also evaluate the soft tissue with what we call an ultrasound. Sometimes they do need a CT scan or an MRI. Then we have our basic examination, and we go through with a variety of different treatment plans, ranging from what we call conservative care, like having them just change their shoes, or perhaps making an insole to let them walk a little straighter and better if it's a biomechanical problem. If it's already arthritic and severely deformed because it's been there for a long period of time, these surgical options are explained to the patient, and they have to decide what they'd like to do.
In other words, if you have it, there are many things you can do to relieve the situation.
Absolutely. It can be ranging from conservative care through surgical.